Welcome back, everybody. It's Medical Monday with East Cooper Medical Center. East Cooper is the ABC News 4 hospital expert. Today, orthopedic surgeon Dr. H. Dell Schutte joins us to explain the latest innovations in joint replacement. Doctor, welcome to the show.
Thank you so much. Thanks for having us.
Great to have you here. Well, why don't you tell me about joint replacement, some of the trends right now, and who really would qualify for a joint replacement?
You know, the point at which you qualify depends on when you start having enough pain in your joints that you really can't do the things you like to do. You know, if you used to walk 18 holes and now you can only walk 9, or you're taking the cart and you see your activity getting less and less, at that point you need to think about what's going on and doing what you can to reverse that trend. And it doesn't always involve joint replacement. There are a lot of things that don't require surgery that can be done to increase your activity.
So if you're taking a couple painkillers, regular over-the-counter stuff, and it's just not doing anything anymore, that's when it's really time to go and talk to you.
Right, and that's, you know, the painkillers don't really fix anything. So
Right.
you're just kind of covering up the symptoms. So ideally you would like to, quote, fix what's happening and get back to a more active lifestyle. You know, motion is life, so the more active you are, generally the happier and the healthier you are, the better it is for your heart and lungs. And that's our goal, is to keep people moving as much as they can, as long as they can.
Well, you mentioned fixing the problem. How exactly do you guys do that?
But for the most part, in the knee particularly, it's more of a resurfacing, kind of like retreading a tire. You recap the ends of the bone where the cartilage is worn out, and there have been a lot of significant advances. We used to do the whole procedure, which takes about 45 minutes. Now we used to do it with a tourniquet, and you can imagine having a string around your finger for 30 minutes. That would be pretty painful.
Right.
When you can do the surgery without a tourniquet now, which speeds the recovery. We want people walking the day of surgery. We've actually installed a little putting green in the rehab so that they can even take a few swings with the putter that day. And if somebody's fairly healthy coming in, many times they can even go home the next day. So,
Wow.
That's an advance. There are some advances in pain management so that it's a less painful procedure, and a lot of different techniques, both with the implant, the actual surgical technique, as well as the pain management, that get you up and going earlier.
Well, tell me about some of the results that people who undergo this process or one of your processes can expect.
You know, we expect people to be more active before surgery than they were after.
Yeah.
That's the goal. So there are people doing, with joint replacements, all kinds of activities, professional golfers, athletes, you know, even some skateboarders and wakeboarders. We don't necessarily encourage that, but we have patients who do that. Some who are very young. Some, unfortunately, have had joint replacement even in their 30s and 40s. But the whole goal is to get you back to a more active lifestyle and let you continue to do the things you like to do.
You mentioned it's pretty non-invasive. What's the recovery like? You said you had some people that were up and walking around, but what kind of side effects can you expect?
Well, I think it usually takes about 3 months to be more fully recovered. But we like to, as an average, people are recovered beyond the point of when they came in at 4 to 6 weeks.
You have to do a physical therapy program?
A physical therapy program in terms of in protected walking. Most people have crutches for a week or so, and then maybe a cane for a week, and then they go on to the walking without assistance. Most people drive at about 2 to 3 weeks.
Yeah, go ahead.
Yeah, well, it depends on how healthy you are coming in, obviously, but sometimes if you can catch it fairly early and get to the cure before it's become too great, then you can recover a little quicker. We had the experience a couple weeks ago of going to Central America, to Panama.
Yeah, on a personal note, you just made a great trip.
It was incredible. We took the whole team, anesthesia, the nurses from the OR and the ward, and we were doing joint replacement. And it was very interesting. Some of the population there get to medical care much later in the process, so they're essentially wheelchair bound. And the gratitude and the appreciation of people who've lived with such significant pain for so long was really reassuring to see. But the advantage here in the U.S. is that you don't have to wait that long.
Exactly.
Excuse
And
me,
nor
before
should you,
get
because
right.
exactly, if you have access to this care, it can really change somebody's life.
Well, and I think the recovery is a little quicker the earlier you can get involved.
Sure. Well, Doctor, thank you so much for being here. We really do appreciate it. If somebody wanted to check you out personally for one of these great replacement surgeries, what would they need to do?
We're at East Cooper. The phone number is 971-9351, and we're happy to help.
Well, pleasure to talk to you, and make sure you check that out right there to get moving once again. That's what it's all about. Doctor, thank you so much.
Thank you.
Appreciate you taking the time. More Low Country Live coming up after the break, so make sure you stay with us.
This segment was sponsored by East Cooper Medical Center.